Hi everyone, I'm Sophia. I'm one of the nurses here at Dr. Beth Collins Plastic and Reconstructive Surgery. I'm here to talk to you guys a little bit about some pre-op and post-op care regarding abdominoplasties, brachioplasties, thigh lifts, and anything really body contouring. So first, before you even go to surgery the night before, just a reminder not to eat anything after midnight, no food or drinks. We're also going to send you home with this little care package. Inside the care package has what's called a HIPAA cleanse. I want you to shower with this the night before your surgery. Also, the morning of your surgery, there's another one for you to shower the morning of. As far as that, make sure you have a ride to surgery and a ride home from surgery, and then you'll be ready to go. The night of your surgery, I want you to make sure you have a ride to take you home and someone to kind of take care of you for the first day, just to make sure that you're not by yourself and everything will be good. So the night of surgery, you're gonna keep all the surgical tape on that they put you home in surgery. Just let it be. We really want you to relax. You can do like a little sponge bath if you need to, but no need to shower on that first night of surgery. Within 48 hours of your surgery, you can go ahead and shower with a fragrance-free soap. We do send you home with one in your post-care goodie bag, so you can use that, or just something without fragrance or chemicals, etc. So when you're in the shower, that's a good time to remove that surgical tape that they send you home with, that you're all bandaged up, so it's not tugging at your skin. This is where the fun part comes. So in your surgical bag, we send you a little bit of paper tape to use. So when you get out of that shower 48 hours after surgery, I want you to take this out, and I'm gonna kind of demonstrate here on you as well. So this will be off. You're gonna pat the area dry and then apply the paper tape to anywhere that you have incisions. So if you had an abdominoplasty, you might have an incision here. You're gonna put a little gauze and paper tape. You're also going to put paper tape along the incision line that goes around the circumference of your abdomen. If you have a thigh lift done, your incisions will be a little bit lower here, so you can go ahead and apply some paper tape there. And then as far as brachioplasties, you can't see on the mannequin, but behind your arm, typically, usually like right behind here is where the incision site will be. Same thing, you're going to go ahead and put some paper tape. That's really it as far as care for your surgery. And then afterwards, after you're all taped up, showered, cleaned, we do send you home with 2 garments. Depending on which of those surgeries I mentioned, your garment will be a little different. These will get mailed to your house for you. So for abdominoplasty, it's kind of like a one-piece swimwear. The thigh lift will be more like leggings, and a brachioplasty will have like arm sleeves for you to put on. I want you to wear these garments for about as much as you can, 24 hours a day if you can, for about 4 to 6 weeks. This is going to keep you nice and tight and binded, help with inflammation and swelling. And then yeah, that's really it as far as post-care. A couple other things to keep in mind. We do send you home with some pain medication just to ease that comfort for yourself. Take those medications as prescribed and take them as needed as prescribed. So if you're not feeling that abundance of pain and you don't need the narcotic, you don't have to take it. It's not mandatory. It's an as needed medication. Make sure if you are taking that narcotic, you're not driving or operating any motor vehicle. As far as when you can drive for these surgeries, kind of do it when you're comfortable. I'd say give yourself a week or so, and definitely no traveling in any airplane for up to 2 weeks. So typically for these body contouring surgeries, you'll have some drains that look like a little light bulb in. You want to keep those drains to suction, meaning you're going to squeeze the drain so it's closed, and then everything will kind of fall through that and collect in that bulb. So we want you to make sure you're accurately recording that output. You can just do it once a day, and if it's recording like a lot of output, if you're having a lot of output in that drain, you can do it morning and night. We will call you on the first day of your post-op journey to let you know and kind of answer any questions. but typically we'll see you on the 7-day post-op. In those 7 days, if your drain is recording less than 20 cc's of output, and for 2 full days, you can give us a call and we can remove that drain for you. If not, we'll remove it on day 7. But the goal is for that drain to have less than 20 cc's of output for 2 consecutive days in order for us to safely remove it. Typically, they're about here and here. So that's just one thing to expect with the drains. They're typically like a reddish, clear output. If you see any that has like green or yellow or has a foul smell to it, you can always give us a call if you have any questions as far as the drain. But those are little signs and symptoms to watch out for. Again, some signs and symptoms of infection include fever, chills, aches, severe pain unrelieved by pain medication. So those are all just little tidbits to keep in mind. Just going to mention one of our most common and frequently asked questions when you're going through any abdominoplasty or body contouring surgery, such as a brachioplasty with the arms, thigh lift, or even some liposuction. So number 1 is, when should we change our tape? We're going to change this tape either after the shower. Typically, we want you to shower once a day if you can, as tolerated, so you can take the tape off in the shower. It'll ease some of that comfort and not cause a tugging sensation on the skin. So we want you to at least change the paper tape once a day in all of the areas that have incisions. So here for an abdominoplasty, and the back of the arms for a brachioplasty, and in between the thighs for a thigh lift. As far as another frequently asked questions with body contouring surgery, often we want to know, when can we work out? So we really want to give our body some time to relax and not be strained. So the first 4 weeks, we want you to take it very easy, doing brisk walks, not really increasing your heart rate drastically. So we want you to walk and move your body, but not necessarily put any strain on your body. So brisk walks are good for about the month. Then after that, you can start to slowly increase some weight activities. When you have a brachioplasty with the arms, we want you to avoid this motion. Your body won't even want to do it. So you can stretch a little bit, but as far as this motion, you're going to want to avoid that for about 6 weeks as well. And you also are not going to want to lift anything that's over a gallon of milk size. So for the first about 4 to 6 weeks, until your body is healed and relaxed. When you're going to endure some exercise activities after the 4 to 6 weeks and kind of get back into the gym and lightly work out, listen to your body. Your body's going to tell you when it wants to take a break. And also make sure you're wearing your compression garment. We want you to, like I mentioned, wear it 24 hours a day as tolerated in those first 4 to 6 weeks, but especially when you're exercising, to keep you all snug and comfort. Hopefully that answers some of your questions, and if you have any other questions, feel free to contact the office, and either myself or one of the other providers can help you. Happy healing.